Okay, so let's take the next question. Our next question is, which of the nerves given could be damaged during the submandibular surgery? Okay, so the option A, hypoglossal nerve, option B, marginal mandibular nerve, option C, facial nerve, and the option D is the lingual nerve. Now, your lingual nerve is going to be the answer here. Your lingual nerve is one of the most important nerve that is easily going to get injured during the submandibular gland surgery. Now, let's try to see why. Okay, so this lingual nerve is basically originated from the mandibular nerve. Okay, so as it is a branch of the mandibular nerve, it basically lies closely related to the submandibular duct or the Watson duct. Okay. Now, this nerve, the lingual nerve, that basically lies deep to the submandibular gland, but it basically forms a loop, and that loop, after forming that loop, it basically crosses the Watson duct. Okay. So, as it crosses the Watson duct, it basically makes the nerve much more prone to injury during the submandibular gland gland surgery, right? So, this is why we are so much worried about lingual nerve during the submandibular gland surgery. Now, we have to understand what function it does, right? So, in case of injury, obviously, that function is going to be lost, right? So, this lingual nerve basically carries the general sensation in the anterior two-third of the tongue. And not only the general sensation, it also carries a taste sensation. And that taste sensation is basically carried through the tympanic nerve, right? So, that's why in case this lingual nerve get injured during submandibular gland surgery, it can easily causes some amount of the problem to the patient. So, the patient is unable to had like this a general sensation as well as the taste sensation. Now, this lingual nerve also going to supply like the parasympathetic supply to the submandibular gland and the sublingual gland as well. So, obviously, this is going to be the another problematic area for us. Okay, so that's why we have to very much careful while doing the submandibular gland surgery, just not to injure the lingual nerve. That's it. Okay. Now let's try to understand the other option. So obviously, other option we have the facial nerve, which is not uh, related to the submandibular gland. It's basically related to the parathyroid gland. Okay, so during the parathyroid gland surgery, this uh, um, a facial nerve eventually get injured very often. So that is one of the important aspect of the parathyroid gland surgery. Okay, but not in case of submandibular gland. Okay. Now, in case of the hypoglossal nerve, look, this hypoglossal nerve is basically situated in the submandibular triangle, just close to posterior belly of digastric. So, as we all know, like this submandibular triangle is basically formed by the a mandible, like the lower border of the mandible, there is anterior belly of digastric and the posterior belly of digastric, right? So, this hypoglossal nerve, it is basically closely related to the posterior belly of digastric, okay? And it basically is situated just deep to this gland. So, obviously, the risk is there, but it's not very much. So, while doing the deep dissection, obviously, there is a few chances of the hypoglossal duct injury, hypoglossal nerve injury is there, okay? But not like lingual nerve, okay? Now you have the marginal mandibular nerve. So this marginal mandibular nerve is basically a branch that has been originated from the lower trunk of the facial nerve, which is basically a cervicofacial trunk, right? So this marginal mandibular nerve basically crosses the inferior border of the mandible, and following that it basically turns upward to supply the lower lip and the chin areas, right? So obviously, it's basically situated somewhere. Uh, it basically situated somewhere superficial to the gland. So obviously, during the deep dissection, obviously there is a no risk of marginal mandibular nerve injury. But obviously, in case of superficial surgery, few risk is there. Okay, so these are the incorrect options for you. Now let's try to look in this image as well. So as I have already mentioned, so this is your marginal mandibular nerve, right? So this marginal mandibular nerve basically originated from the lower trunk, and it basically crosses your mandible and then basically turn upwards to supply the lower lip and the chin area, right? Okay. And obviously you can easily able to understand, obviously it basically at risk, but only in case of superficial cases or superficial injuries, not in the deep. Let's try to understand here. In this case, uh, we have this this is your Watson duct. Okay, so this one is your Watson duct and this one is your lingual nerve. So obviously you guys can see that lingual nerve basically takes here, there is a formation of loop, you can easily see that, right? So this loop has been formed, and obviously then it basically crosses the Watson duct to supply the tongue. Okay, so this is where it basically at risk of injury. Okay, at risk of injury. Okay, so here option D, lingual nerve, is going to be our answer.